permission before you do it? Do I have your permission to share 2 things with you that will prevent gum disease? Or are you interested in hearing 2 things that will help prevent gum disease? What we found is in our students testing this out, they wanted to know what the emotional hook was to get people to listen to information, and it wasn't to learn about gum disease. Have you ever noticed they really don't care? And they, sad to say, they aren't even that interested in the oral systemic link. They're much more interested in fresh breath. So one of our students did her research project asking half of the patients and saying to the patients, are you interested in hearing 2 things that you can do to help prevent gum disease? And the other half of the group, she asked, are you interested in hearing 2 things you can do to have fresher breath? The majority of patients wanted the information on fresher breath, and nobody wanted perio information. So it's wording your question appropriately to see who wants the information. Another student was asking 9 patients in a row if they wanted oral hygiene instructions. 7 flat out said no, and the other 3 said, only if you want to do it. So simply ask your patients if they want information before you give it to them, and it will save you a lot of time. Why give all the information to the people who aren't listening anyway? And they'll be thrilled that you listened to them and followed their wishes. And surprisingly, they may even ask you questions by the end of the visit. So for some of you, this is intuitive. Some of you are a natural detective and are comfortable with open-ended questions. But for others here, it will take time to learn, and it will be frustrating. I even have some students who keep a cheat sheet of a couple of questions handy in their operatory because it's so easy to get into the routine of saying the same thing over and over again to patients and not listening for their answers. So keep in mind the question that will be helpful. Tell me more about whatever it is they've just said, and you'll learn a lot more about what that person is thinking. So let's finish our questions on a scale of 1 to 10. See if you've changed your answer. How important do you think it is to focus on behavior change in dental school and clinical practice? Anybody, I hope, find that they changed their answer and it's a bit more important than you thought in the beginning? I hope. Next, on a scale of 1 to 10, how open are you to changing your approach? Anybody at least move 1 notch to be a little bit more willing to change, I hope? So we've covered topics in a quick sequence here, certainly not the way Dr. Ramsire would like with many hours, but we at least introduced the idea. And I want to have you reflect on what type of questions you might ask during this conference. Try and ask more open-ended questions of your colleagues to learn more about how they're thinking and why they're thinking that way. But have fun with those asking open-ended questions while you're here. I want to thank you very much, and I'll take questions later, and we can hopefully get back on track that way.
Well, thank you.
Thank you.
But despite the fact that Tricia is, of course, a professional educator in communication, as we have seen, clearly, I would like really to have open space for questions, because we are not so strict in timekeeping in Italy. So if you don't mind.
There we go.
This is a sort of compliment as a male.
Thank
you.
I appreciate that.
So, of course, in the system there is no question just now, but please, just to facilitate the work of Argiro from the next session after the coffee break, consider that we have, may I have the system on the screen? What is actually appearing?
There is one question over there in the middle, so
yes,
I try to...
and I've already said, Tricia, that we have the empowerment of patients. It has to be part of our...
Right, someone did write that comment that the empowerment of patients should be part of the curriculum. I like that.
Any other
yes,
questions?
I think it's on.
Corrado, is it all right? Can you hear me?
Yes?
Yeah. Can you hear me? Yeah. Oh, thank you, Tricia. It was really interesting. Having said you want open questions, I just wanted to say, with regard to flossing, I've got these. They're TP brushes, and they're, in my opinion, better because they're different diameters. So I've got a few more in the bedroom, in case nobody's seen them.
They're better because people will use them.
No, because they're different diameters, whereas dental floss is only one diameter, and you've got different gaps between different teeth. But the other thing I wanted to suggest, I might be wrong, because I'm an educator, not a dentist, is that, you know, when you were saying about students expecting to just listen, certainly in the UK, we try and get them to pose questions and interact. I think the education approach across the world differs from country to country.
Absolutely.
That's all I'm saying.
And that's wonderful
Yes.
to learn that from all of the people here. So I commend you that that has happened in your schools.
So ADEE is planning this for the future because, as you know, there is a joint action and a SIG on ADEE and ADEE interaction for the future, and we kindly invite to take part in that in the future.
And one of the things about asking questions is that we have to be willing to have the students question what we're teaching. Because if we just teach the status quo, that's all we will get is students learning the status quo. We want students who will achieve higher levels than the educators. So we want them to question and look at other ways that may be even more effective.
But of course, the coffee break is behind us, so maybe people is less shy during the coffee break.
think
And
that might
Trisha,
be,
for
yes.
sure, is available during this. We have been awarded 20 minutes of coffee break instead of 30. And this is very kind of Trisha because we have shrunk the relation. Thank you very much for everything. And of course, a sweet present. We will be back in 20 minutes. That means 11:25.